Hi, I'm Danny Aronson, the CEO and co-founder of Tuned. Tuned is a comprehensive hearing health benefit that allows employers to offer their employees comprehensive hearing health, just like dental and vision. And in this series, I'm joined by Dr. Heather Malyuk, sorry, Tuned's head of, let me start again. Just like obviously the moment I started. Hi, I'm Danny Aronson, Tuned CEO. Tuned is a comprehensive hearing health benefit that allows employers to offer their employees comprehensive hearing health from prevention to intervention, just like dental and vision, as a benefit. And in this series, I am joined by Dr. Heather Malyuk, our head of audiology, and showcasing our incredible, favorite, amazing partners that make Tuned such a great platform. And today I'm happy to have Brian Maguire from Lexie join us to share about Lexie and the incredible product that they have, and we'll take it from there. I'll do this another time. My mind is kind of that, but we can take it from here. So Brian, and Ken, and we can edit this, right? So we'll just jump to this. So Brian, thank you for coming and thank you for being here. Really appreciate it. And I'd love to hear a little bit about you and a lot about Lexie and a lot about the great work that you guys are doing. And please.
Fantastic. Thanks, Danny. Thanks, Heather. Appreciate you guys having me on as part of the series. And my name is Brian Maguire. I'm the Senior Vice President for North America for Lexie Hearing and HearX Group. We're an impact-driven hearing health company that's really focused on healthy hearing for everyone, everywhere. That's the motto that we live by and try to drive our entire business by on a regular basis. And we're involved all the way from screening of hearing loss through diagnostics, all the way through intervention with over-the-counter hearing aids.
Wonderful. Wonderful. I'm going to dive in and ask you some things.
Right.
And I think the first thing, let's just dive into the sort of product, what it is, who it's for. We have people listening who aren't sure what an over-the-counter device is, what type of hearing loss it's for, how they get it, that kind of thing. So tell me what's unique about Lexie and who's your ideal end user?
Yeah, perfect. When I think about who is this for, it's really for anyone. The typical is somebody who has mild to moderate hearing loss or severe or profound, but really this is for people who are health engaged, who want to engage in conversation and connect with relationships and be able to hear things better. That's who really this is for. Our products are really particularly for those people who are high health engaged, but also technology engaged, that they love to engage with technology. They can do things on their own oftentimes, but also enjoy that simplicity of checking on how is my health going and how am I doing. So that's really who our products are for. Our over-the-counter hearing aid products. And if you're not familiar with over-the-counter hearing aids, it's essentially a way for people with perceived mild to moderate hearing loss to get help to be able to hear better. Now, no hearing aid, of course, will restore your hearing. That's not what hearing aids do. But people struggle to hear oftentimes in the presence of noisy environments, and they have difficulty having conversations. This limits their social interactions, can oftentimes make you less productive at work, as we know. These are really critical things that are important. So as people notice these factors, they start to really need help in these areas, and that's where we can help them. Our products are specifically intended to be sold or shipped directly to the consumer, and they, within about 30 minutes of their own time, can unbox the device, download the app, and conduct a quick hearing test that actually enables them to recommend settings to program their hearing aid. So they're back in business within an hour of actually getting our products in their home.
That's wonderful. I think one of the unique things about Tuned and hearing health as a benefit is having audiologists like myself who are familiar with products like yours, where we can do the triage aspect of seeing, is this person a good fit, and then guiding them toward that. You mentioned the term perceived mild to moderate hearing loss, and I just want to touch on that for a moment because the individuals listening might not realize what that means. It means anyone who thinks they are having difficulty That's
Yeah.
truly what it means. And in the old days where you had discounted hearing aids as a benefit, where maybe you needed to have more severe, profound hearing loss, we are actually helping individuals who say, I'm having trouble in the workplace just distinguishing because there's background noise. Or I'm going home after work and I'm so fatigued from the difficulty I'm having listening all day that it's making me not enjoy my workplace anymore. So just to give an idea of who the folks we're recommending this to have just slight hearing loss, where if they would go to a traditional old school, clinic, maybe they wouldn't be able to afford it. But this makes care very affordable for people who just need a little bit of help, and like you said, who are engaged in their health care. So one follow-up question I wanted to ask, because we are comparing this more severe, hearing aid style versus OTC. Is there a big difference between Lexie and an OTC hearing aid? Or excuse me, prescription hearing aid, and what is it? Just to give the listeners a better idea.
Yeah, great question. So I think this is where our wonderful partnership comes into great use. So obviously the team from Tune can really assess where is the person in terms of their hearing loss, where might they be through a series of screeners or diagnostics. And then we can accurately recommend what is going to be the right product for you. So in terms of, if you think about the total overall hearing loss, the number of people affected with hearing loss in the US, almost 85% of them fall into that mild to moderate category. So it is the overwhelming majority. There are certainly going to be folks who have severe or even profound hearing loss, and they need medical prescription or other devices that are going to help them, with their hearing loss. So it is the majority of people who do have hearing loss that these products could be suitable for as an option. And our products are really focused on that person who likes to take the power and the control of hearing or anything in their life into their own hands. Certainly they have the do-it-yourself nature where they're saying, gosh, I could save thousands of dollars here from a traditional route, but also have immediate control and the ability to actually fine-tune my hearing, customized to them by them. So it's an individual experience that they can provide. It's not a generic set of prescriptions that is given to them. And that's how they can do that immediately.
Yeah, I think that's a really important point, that kind of flexibility. And I know that, of course, there's an app component, but
Yeah.
Lexie also offers follow-up care. So you mentioned earlier that within, the first hour of receiving the devices, someone can have them on, using them, start tweaking them. Do you find that let me rephrase. Do you find that it's so intuitive, which of course my age group finds it to be intuitive, which is working age folks, that they don't need the follow-up care? Or do you find a lot of people taking advantage of follow-up appointments?
Yeah, we actually do. We have two cohorts of owners, really, is what we've seen. These are the people who love to do it themselves, have grown up with technology, they track their steps, they track their health in other ways. So they're really kind of self-engaged, right? We have over 90% onboarding is what we call. So the product actually ships to you with a rechargeable pair of hearing aids that, of course, you acoustically tune and physically fit yourself. That's all through the onboard process. If you have any questions with that whatsoever, in the app, you can live chat, have a conversation either through text, SMS, or a video call like we're having on demand or by appointment. And we'll help you through that setup process. We find there's a cohort that says, that's perfect for me. That's all I need. I'm off and running. And thank you. And I'll check in occasionally as they need upgrades or maintenance items over time. But then there's a cohort who really wants that helping hand. And we have a program called Lexie Rewards. This is a unique program that only really Lexie offers, and it's to help folks not only that first 45 days of acclimating to a hearing aid, gives them tips, it gives them activities to earn rewards points towards future dollars, but over time, we give them activities. We even notice perhaps if they're having difficulty with their app, and we'll send them either a proactive call or a text or a communication.
Wonderful. That's wonderful.
I think that's one of the things that we're seeing consistently is that even the fact that people might go through the screening, have a consultation with the audiologist, and the result of that is you could really benefit from a traditional hearing aid. People might be very reluctant from a psychological stigma perspective, especially in the workforce, to make that leap. And I think one of the things that we are making it, or historically the hearing industry has made it very challenging, is that there were no entry-level devices. It was either it's all or nothing, both in terms of price and in terms of prescription and the process. And I think what I love about the Lexie offering is that it is very intuitive, very easy. It doesn't feel like a huge like a huge hugely difficult process to go through. As I said, very intuitive, very easy. And we're seeing that people are much more open to saying, you know what, if this can improve my quality of life, if this can help me, hear better, communicate better. And I think one of the things that Tuned really does well is explaining to people that hearing is communication.
Yeah.
We typically don't talk about that, but hearing is the ability to communicate with people. So, and I think people are seeing great benefits of that. So I think this idea of having something like Lexie as an over-the-counter device, which is self-fitting, up and running within 30 minutes, very easy to use, feels very modern, it feels like all of us use all these devices all the time. So Lexie feels a part of that. It feels very modern and very accessible. So I think that's fantastic.
Yeah.
Dan, I was just going to say it's a great point. And one of the things that we have is an exclusive partnership with Bose, right? So this has really helped us on the acoustics and audio quality as well. So Lexie, all of our B2 product that we were talking about is powered by Bose. And certainly this helps provide the consumer with great acoustics, but also one of the biggest breakthrough items is this is the first self-fitting or self-tuning algorithm that lives on your smartphone. And the biggest technical breakthrough was actually taking this very complex fitting method and distilling it down to two simple wheels, so to speak, that live on your app. And that is one, to adjust the volume of the world around you, or the amplification levels, to increase the amplification levels. And two is the tonal balance. So it simply puts this in terms consumers can understand, know, and get to associate with immediately.
Absolutely. And I think that's sort of what we're all going for, is making hearing health not just accessible in terms of the products, but in understanding. I know with a lot of our appointments, we're very educational. We want folks to understand their hearing. It's been sort of a mystery up until recent past. So I think that's a very big deal. During this series of videos that we're making, I have been asking companies for their favorite stories or examples. I'm going to ask you something slightly different, which is, I know Lexie and HearX, you have initiatives that you do throughout the world to help others. And I think it really speaks to the heart of what you guys do. And can you take just a couple of minutes and tell us about a few things that you have going on?
Yeah, absolutely. As I mentioned before, we truly feel we're an impact-driven organization down to the roots. Our co-founder, who still very much is involved with our business today, is a professor out of the University of Pretoria in South Africa, and one of the most published audiologists around the world. He's fantastic. And we also have a foundation called the HearX Foundation. And this is really born out of the initial desire to provide healthy hearing to everyone everywhere. So this foundation really focuses on underserved communities in Africa, particularly for school-aged children and also older adults who don't regularly have access to actually getting hearing screening on a regular basis, or any intervention for that matter. And this year alone, we've done over 200,000 tests in the South Africa home country of ours. To just give an example. And we also try to do that internationally. HearX actually makes the hearing screener for the WHO. So if you log on and you download Hear Who or Hear WHO app, that's actually powered by HearX under our initial technology.
Wonderful. Thank you, Brian.
Yeah.
That's all my questions.
Okay. Brian, anything else you'd like to add or share? Anything on the roadmap that you guys are looking at going into, the next year or so, that you'd like to share?
Yeah, I think, look, for the entire workplace audience, if you are struggling with hearing loss, or you're beginning to see the signs, or also importantly, if you have a loved one who you're beginning to see the signs with, the Lexie B2 hearing aids can be a perfect solution for you. They're simple to use, rechargeable, connect to iOS or Apple devices and also now Android devices. And they're a great way just to reconnect, have conversations, and take that first step, right? It's not a major hurdle that you have to overcome or go to multiple appointments or spend thousands and thousands of dollars. This is a high quality, high performance pair of hearing aids that you can get for, as you know, very affordably, and they're immediately accessible. And if you don't have a great, fantastic experience with them, you can always return them. That's the wonderful part about this. So I think I would advocate to people, get help sooner if you even remotely think there's something that you could benefit from here.
100%. And I think it's important to understand that in terms of the tune process, typically when an employer adds tuned as a benefit, the employees have the ability to go through an online screening. They then have the ability to go through an online consultation with the doctor of audiology. And if the results of the screening and the conversation with the audiologist suggest that a device like Lexie could be beneficial to the member, they literally, at no extra cost, no out-of-pocket expenses, it's all part of the program, would get a pair of Lexies delivered to their home typically within 2 to 3 weeks, and have both the benefit of the assistance of their tuned audiologist or the Lexie platform. We've seen quite a few people getting that opportunity. And I think one of the things that to me is very noticeable is there's, because of this process, which is so heavily guided by audiologists, there is a much better sense of understanding and expectation setting with the members as to what exactly is this going to look like, how is it going to feel, what can I realistically expect it to do? Because just like you said, Brian, we can't magically repair your hearing, or and that's why hearing loss is a very apt term, because once it's lost, it's lost. But we can help you, and we can amplification obviously can help, and the setting of expectations is something that we found very efficient and effective for our members.